Welcome to the podcast of the American Journal of Psychiatry Residents Journal. I'm media editor Dr. Shawn McNeil, and today I sit down with psychiatrist Dr. Pamela McPherson.
I'm Pamela McPherson. I'm an adult, child and adolescent, and forensic psychiatrist. I've trained in Louisiana, South Carolina, Ohio, and New Mexico, so I've enjoyed different styles, different environments, had great training years, great mentors all along the way. In medical school, I had planned to study pediatrics. I really enjoyed working with children from a young age. I had done volunteer medical work with children in Nicaragua as a teenager.
Wow.
And so even starting medical school, I planned to do pediatrics. I did an elective in child and adolescent psychiatry with Dr. Leatherman, one of our longstanding mentors here at LSU.
Right.
Just because I thought a pediatrician should know something about child psychiatry. And I enjoyed that time with him so much that I started to think more and more about psychiatry and considered other options at that point. In medical school, I was fortunate to have an elective at the National Institutes of Mental Health to be able to see firsthand some of the great work that goes on there, the important work, and then that helped to solidify my goal to be a psychiatrist. That was a shock to my family. My father's a scientist and was sort of questioned that move away from more traditional medicine. One of my grandmothers asked why I wasn't going to be a real doctor after all these years. So that stigma of psychiatry hit, but I stuck with it, and it's been a great ride. It's been a profession that I've loved and continue to love. I enjoy working with children and their families at a community mental health center, and my forensic work has brought me all across the country, primarily looking at conditions of confinement in facilities for children and adolescents, and then more recently work with Homeland Security, looking at the conditions of confinement in facilities that house women with credible asylum claims. So I've been able to feel that I assist families individually in my day-to-day work, but have an impact on large systems through my forensic work. And that's been very rewarding.
Okay. And so, it sounds like you've had, thinking about pediatrics first, you kind of had this emphasis on children the entire way through. Do you think that informed the way that you developed as a psychiatrist even before your child and adolescent training? Do you feel like you thought about development more even when treating adult patients?
Definitely.
Okay.
Adult psychiatry was something that had to be endured to do child and adolescent.
Okay.
I always knew that I would be child and adolescent. Adult was never my goal. And so as I did electives in forensic psychiatry, my mentors at the Hall Institute in Columbia, South Carolina, would give me the adolescent cases.
Okay.
I did my general medical rotations for my intern year on pediatrics. I always intended to do child and adolescent psychiatry. I had the good fortune during my general residency to do an exchange program with Scotland. And so I spent a few months in Scotland looking at their mental health care system for children and adolescents and their juvenile justice system. So any elective time I had, any extra opportunities were always focused towards child and adolescent and the forensic arena for me.
What do you feel like was the main motivation keeping you, getting you into the field of medicine first of all, and then, I assume having a parent who's a scientist, it made you lean that direction, perhaps. But what did you feel like was the main driving force behind getting that career started in the first place?
growing up, I lived in Central America, and we often saw persons in need of medical care. People with injuries, people with infections, things you wouldn't see on the streets in the U.S., but I would see day to day in Central America. These things had an impact on me. The impact that a physician could have on the life of a child was something that I was aware of from a very young age. Doing volunteer medical work in Central America as a teenager convinced me that it was something I could do and something I would enjoy, and I just never looked back.
Okay, well, that's good. And, we're glad you never looked back, because we get to have you. You're one of my supervisors, but you've been around the program, and you've been a source of inspiration for a lot of us, especially those of us that have thought about, or those who actually have done the 2 fellowships and kind of followed in your footsteps. So, I guess shifting gears a little bit, I did want to ask about how do you balance the personal and professional aspects now that you have a career that you've been in for a while now? How do you feel like you balance that?
So over time, that balance definitely gets easier. But I'd like to talk a little bit about starting out.
Okay.
Because that dream we have of our professional practice never comes to fruition without a few bumps. So I would encourage all the early career psychiatrists listening to really give themselves time to navigate and to plan for that professional career. I completed my fellowships and began my professional career working for a hospital. That didn't suit me well, and I went into academia. During this time, I didn't have children, didn't have a family. I could go wherever I wanted, do whatever I wanted. And I know it was a bit of shock to you to learn I had no debt because of the low cost of medical school at the time, in the 80s when I finished. So it was a real luxury for me to be able to make decisions based on my own desires and nothing else. I completed a few years in academia back in South Carolina, and then when I married, returned to Louisiana, and that's when things became a little more difficult, making decisions with the two physician family, and then having children and having to make decisions based on what was best for the entire family. I found that with one child, I could continue to be active in professional organizations, continue to participate in some research and my forensic activities, which took me across the country. But when I had my second child, that became a little more difficult. And at that point, really before I had my second child, I gave real thought to what career did I want. I realized at that point that having a second child would definitely impact my travel and some of the professional activities I was able to take part in. When my son was born and later had a severe articulation disorder, that further restricted some of my travel and things that I was able to, some of those goals that I had or plans that I had. So I would just encourage early career psychiatrists to really think about what's most important to them in their professional life, in their family life, in their community life, so that those goals can be that prize they keep their eye on when they're making professional, family decisions, and they don't lose sight of those things in the day-to-day life of professional practice and family that becomes all-encompassing.
Right. Yeah, so I think family is one big portion of a person's life that should be considered when starting a career? Are there any other major considerations when starting a career or choosing your career options and parsing through those? Do you think there's something else that should be considered, maybe weighed as heavily?
Well, I think we definitely have to weigh which professional endeavors are rewarding for us as individuals, and where do we have the most to offer. Personally, my husband and I had to balance our careers. He's an anesthesiologist.
Okay.
The reality is that an anesthesiologist has less flexibility than a child and adolescent psychiatrist. But along the way, we've had to negotiate our time to be able to be available for our children in the way that we want to be available for them. And it's worked out well. They're young adults now and doing well, but it's it definitely, you have to be thoughtful in that approach. We put a lot of time and energy into our medical education, and I believe that it's important to use that knowledge, to use it for our patients, but to use it for our community as well, to as a child and adolescent psychiatrist, to help inform others in the community about the needs for children and adolescents, so that that balance of what my family needs, what my patients need, and what's rewarding for me as a physician is something I feel good about now. But there were times that there were struggles. And I think if early career psychiatrists keep those family, professional goals in mind, they can make decisions along the way that allow them, after 25, 30 years of practice, to feel successful and to feel that they've contributed to their profession and their community.
Okay. Looking back at your journey through child and adolescent forensics, building a career in both, what are the types of traits that you feel that would help a person out in a career? Like, say, let's take forensics first. What kind of maybe personality traits or what kind of strengths do you think are important for a person maybe considering that type of career?
So I think many of the traits that a good forensic psychiatrist should have are traits that a good physician should have. There's a rigor in forensics, really being able to justify every decision and back up every decision, that is a general medical skill that forensics hones. And so that ability to research, to understand an issue, to not leave any stone unturned is critical in forensics. But at the same time, you have to have how would I say it? You have to have you can't be put off by having your opinions questioned. As a physician, our patients, for the most part, go along with our recommendations. They respect our authority. That's not always the case in court or when dealing with attorneys. So a forensic psychiatrist does have to be at the top of their game to explain their reasoning, to explain their conclusions. And forensic fellowship really prepares a physician for that rigor. You have to enjoy it and not be put off by it. It's been likened to, court has been likened to a chess game. There are these moves happening. You don't know what the attorney's next move is going to be, but you've got to be prepared for it, and you have to think ahead.
And that seems so foreign to someone who hasn't really experienced it, even to a general psychiatry resident who has very little forensic experience. What do you think has been the biggest challenge in the forensic arena that you've faced?
Personally, the most difficult cases or death penalty cases.
Okay.
There's some of the child abuse cases or child cases can be heartbreaking and can be difficult in that way, but the death penalty cases, a life is riding on this court process. I have come over time to realize that I'm not the engineer of that train.
Right.
I'm in one of the cars.
Okay.
I'm riding along. There's something that I can contribute. There's important information for the court regarding competency or sanity or mitigating factors. But what happens in the case, I'm a player. I'm not the driving force.
Okay.
And understanding my place in that process has allowed me to work on very serious cases without feeling overwhelmed.
Okay, good. And one more thing I wanted to touch on is the topic of mentors, having good mentorship while you're in training, and then, you know, what it's like from your perspective being a mentor to these new trainees, and what's your experience?
So I have been very fortunate to have wonderful mentors from medical school all throughout my career. It was certainly a highlight to be able to train with Dr. Resnick and Kathy Quinn during my forensic training in Cleveland. And just as one example, I would say that Dr. Quinn's ability to be totally with me during supervision was a quality that I've tried to take away and use in my professional practice, but also in mentoring. She had a very unique ability to be totally present in the moment. And so that's something that I've tried to emulate. Many of my mentors have been very generous with their time, even throughout my professional practice, and rarely wanting thank yous. What they would say is, when you're a physician, give back in this way. And I think as physicians, it's important for all of us to channel those great mentors that we had and to give back, because there's so much more to the art of medicine than the books and the science. And the art of the medicine is really what our mentors and our patients teach us.
Well, I appreciate hearing all of that, and also appreciate you being one of my mentors. So thank you so much for sitting down and answering some questions with me, and hopefully this helps someone out there who's also might be confused or might be wondering about what it's like to follow in those footsteps like yours.
Well, psychiatry is a wonderful profession.
Yeah.
I think the future is going to be so exciting as technology advances, as science advances, genetics, epigenetics. The horizon just holds so much promise. It'll be a very exciting career for all of you.
Right. Well, thank you so much.
Sure.
All right.